Welcome back to Freedom and Prosperity Radio, the weekly radio news magazine we put together here at the Virginia Institute for Public Policy, and easily digestible, heard around the Commonwealth and also on our YouTube channel. If you're looking for previous episodes, go to YouTube and search Freedom and Prosperity Radio and then bookmark the page, and you'll always have the most recent episodes of it. Our next guest, Brian Blase, president of Blase Policy Strategies, and our unlawful and just quite honestly dispiriting Medicaid expansion enrollment here in Virginia. We heard a lot about it, and it was amazing. Brian, welcome back to the program. How are you doing, sir?
Hey, Joe. I'm great. Thanks for having me on this morning.
I appreciate it. You know what I thought was amazing? That as their General Assembly was getting ready to do this ridiculous Virginia State Crime Commission, presentations on gun grabbing, they managed to somehow wheedle Medicaid expansion discussions into the debate about whether or not we should have Second Amendment rights, too. Is there anything that they won't try to include this discussion into?
Well, I'm not familiar with what they try to do on that, but I know that there's a lot of money at stake with Medicaid expansion, and you've got a lot of the organized interest groups, the hospitals and big health insurance companies that have a lot of lobbyists in state legislatures around the country and are always looking to get more money into their pockets.
Well, and that's one of the things that I think is lost. All these ads that you see, and funny enough, some of these people are the same ones who complain about Citizens United ruling, but these are ads paid for by the hospital union saying, tell them yes on Medicaid expansion. It's been great. It's almost money laundering, isn't it, Brian?
Well, what we found, and actually, I found a recent economics article in the National Bureau of Economics Research that looked at enrollment in Medicaid expansion states and whether people that received coverage were actually eligible for it, and it matched Medicaid with people's self-reported income, and found that in 9 early Medicaid expansion states, just an enormous number of people who claim to be on Medicaid have income that's way above the eligibility thresholds.
Well, is it because they're committing fraud, or is it the government wants to have numbers that look like we all love Medicaid expansion?
So there's some fraud involved, and there's going to be some pockets of the country where I think there were organized efforts by left-wing groups to get as many people enrolled in Medicaid as possible, and they didn't care what the individual's incomes were. They really didn't care about the rules. I think fundamentally it shows there's just a systematic problem with Obamacare. Like the central planners behind Obamacare thought, would work as they drew it up on their whiteboards, that people who were poor would get enrolled in Medicaid and Medicaid expansion states, and then people who were sort of non-poor, sort of working class, middle class, they would enroll in these exchanges with private coverage, with a government subsidy, and with a subsidy that declined as people's income increased. And what we've seen is that an enormous number of people that have income above that threshold, which is about $35,000 for a family of 4, they've enrolled in Medicaid instead of in the exchanges.
That doing so, and I some of the folks, I think, understandably, they hear the fear-mongering rhetoric that comes out of their radios and their televisions about Obamacare. And I was in a meeting of the Virginia Association of Broadcasters in which the presentation was made as to how many millions of dollars were available to creative television and radio stations and groups that could create programming and content that would help move forward the agenda of the Affordable Care Act. You realize they don't do that just because they're good guys and gals. There's such profit motive to this, but they need first us to agree to it, so they scare us into thinking that Medicaid equals health care or medicine.
Yeah, I mean, I think that's Obamacare was sold on a bunch of false premises. It was sold with Medicaid that if you gave people a source of primary basic care, that they would avoid the emergency room. And we saw that that was false. In states that expanded Medicaid, among Medicaid enrollees. Emergency room usage actually went up.
Mm-hmm.
And I mean, I think the big falsehood was, that hundreds of millions of people have pre-existing conditions and can get health insurance coverage, and that's why we needed Obamacare. It actually turns out that it's a very small fraction of the population that doesn't have access to health insurance, that has an uninsurable condition.
Mm-hmm.
And what they did with Obamacare was take a sort of targeted, a real problem. I don't want to say it's not a problem. It certainly was a problem. But they took, instead of a sort of a targeted solution to the pre-existing conditions problem, they had a huge government spending, subsidy, mandate, regulatory program that's caused a lot of chaos and is really complicated and has these rules that are difficult to monitor. And with Medicaid, eligibility is sort of a local issue.
Mm-hmm.
And the incentives, it's almost all Washington money.
Yeah.
So there's not a lot of great incentives for localities to ensure proper eligibility, because the interest groups in the state and in the local communities tend to be happy with the influx of federal tax money.
Mm-hmm.
So it's basically the number one principle in economics: incentives matter.
Mm-hmm.
And the incentives here are aligned for just a lot of wasteful spending.
Well, and the incentives come from our tax dollars in the first place, Brian. I've always maintained that the government, all our governments at all levels, are just venture capital firms where we have no choice but to give them our money, and then they go out and like the third generation rich kid that doesn't understand how hard grandpa had to work for the money. He just spends it because he's got it. But more, scary is that you mentioned how people are not getting the results they were implied as they were told these things were going to be expanded. And I worry that was the underpinning of the Affordable Care Act, was to collapse the free market health system and insert, national health services like they have in Great Britain. Is that an unfounded thought?
I've heard that and have been asked that question before. And my response to it has historically been the Obama administration was heavily invested in the success of Obamacare, and they worked really hard. They tried to prop it up with insurance company bailouts, but they were invested in sort of this approach. But I've got to tell you, I'm rather shocked by how quickly the Democrat Party has abandoned Obamacare and embraced, with many of the leading presidential candidates embracing Medicare for all.
Mm-hmm.
Basically, they're admitting that Obamacare has failed. It's failed to drive down costs. It's failed to expand coverage as much as they thought. And obviously, this new report suggests a lot of the coverage gains are improper Medicaid expansion enrollment of the middle class. But it does sort of beg the question of, do they want Obamacare to succeed, or was this just a step on their mission for sort of total Washington takeover of healthcare?
Bryan Blase is on with us, former economic advisor to the president, and he was written some great pieces on the Affordable Care Act and in general. BlazePolicy.org is where you can find his work. And thank you for joining us this week on the program. You talked about the expansion of Medicaid into the middle class. That was warned before this even started. It was one of the reasons Virginia wasn't one of the early adopters of Medicaid expansion. And we had even seen it in places like Mississippi, where they were, and then were trying to get out of Medicaid expansion because they saw how quickly pardon the phrase, and I'm going to co-opt the phrase, me too. First, it's for the poor community, and then somebody else says, well, hey, I'm struggling here too. How come I can't get some of that? And politicians generally out there chasing votes for most of the day, are want to start saying, well, I guess if we can come up with a way to get the middle class in here, that'll help us out in the coming Novembers. Was this all predictable beforehand, and yet we still went down this road?
When our experts analyze the proposals from Congress, what they tend to think that they're going to work as the central planners draw them up. And I think, so this study that came out found that of people who have income above 250% of the poverty line, and that's about $65,000 for a family of four.
Okay.
Who reported gaining coverage between 2012 and 2017. It's 65% of them, so 2/3, have gained coverage through Medicaid. Now, those are people clearly with middle-class income. $65,000 for a family of four or above is middle-class income. So 2/3 of the coverage gain in Medicaid expansion states has been through Medicaid. Medicaid is supposed to be a welfare program for the most vulnerable people in our society. That was the intent. So it is like a dramatic expansion. And I can't know for sure exactly what's going on. I mean, I've been a skeptic of Obamacare and have written about it for 7 or 8 years. I was shocked by these findings. I didn't expect that many people with income that much above the poverty line would have found their way into Medicaid. I think it is the fundamental issue with Obamacare. Obamacare is Medicaid expansion. It was supposed to be sort of built on this the private exchanges, and that gets a lot of attention. But the individual market has increased by only a couple of million people. It's like way under where it's supposed to be. Obamacare is Medicaid expansion. So the coverage gains in Obamacare is through Medicaid, and as you alluded to, Medicaid historically has provided pretty bad care and bad health outcomes. So, we have one study, sort of a natural experiment in Oregon with their Medicaid expansion from 5 or 6 years ago. And they looked at whether people's health improved on blood pressure, cholesterol, blood sugar, and it didn't improve on any of those metrics with people who were randomly assigned in Medicaid. So I think the lesson is we're spending enormous amounts of taxpayer money, much of it on people who aren't eligible for the program, with very little benefit received by the enrollees.
The underlying sales pitch was that Medicaid in the 90s was more efficient than the average health insurance HMO in terms of paperwork and cost and everything else. But that was, and I asked people at the time, does that scale up? If we quadruple or, even go beyond that, the number of people on Medicaid, do those quote unquote efficiencies scale up? And it doesn't seem like they have. As a matter of fact, it's gotten far worse than the average HMO, correct?
I mean, the way that it can be efficient is that it doesn't look for like improper, wasteful spending. It just pays claims as they come in. So it has sort of low administrative costs, and it can Medicaid sets rates, and historically it set rates the lowest of any payer in the healthcare sector, which has led to major access problems for people on the Medicaid program, that they can't get high-quality providers that are willing to treat them because the program is reimbursed at such low levels. Now, one of the perversities with Obamacare is that you sort of have this historical problem of low reimbursements for the traditional population, low-income children, pregnant women, and the disabled. And what it did, so that average rate, the federal government on average reimburses about 60% of state spending on those populations. Obamacare reimburses at near 100% for the federal government's reimbursing near 100% for the expansion population, which is mostly able-bodied, working-age adults, primarily men. So think about that. The federal government is providing much greater financial support for able-bodied, working-age adults than it is for pregnant women, low-income pregnant women, children, and the disabled. So instead of shoring up the program for those who really need it, who are vulnerable, we just expanded welfare to able-bodied working-age adults and created an incentive for states to spend more on that population than on the traditional population.
So what do we do? It seems like this is just proving Reagan's axiom of, the only thing near not invulnerability, but immortality is a government program, because I don't see any interest now. We watched an entire Congress go through its motions of not wanting to repeal Obamacare, even though they had the votes to do it. They controlled both the House, the Senate, and the presidency and couldn't do it. So what do we do? What is a good answer for this government program?
Well, I think there's two main answers to that question. One, the federal government needs to do a better job of oversight and monitoring the program, so they can demand states do more frequent eligibility reviews, and they can do audits and then hold states accountable when they have significant errors and improper enrollment, and they can make recoveries for the federal taxpayer. That's something that we urged the administration to do in the Wall Street Journal op-ed that we had last week. The second thing is there's got to be a congressional solution. We can't have the federal government reimbursing so much more for the Obamacare Medicaid population than it does for the traditional Medicaid population. We need to realign and improve state incentives to be stewards of taxpayer dollars. I believe in federalism. I think states are laboratories of democracy, and they should be allowed to take different approaches on policy issues. But the incentives can't be so perverse that they could just get reimbursed. The more money they spend from the federal government, the more the more they spend, the more reimbursement they get from the federal government, with no accountability for results. So we need to fundamentally change the federal-state relationship that has perverted. Has really perverted a lot of conservatives at the state level. Like you hear conservatives at the state level that argue for expanding Medicaid because it's a way to get federal tax dollars into their state, so they can have lower state taxes.
I've heard.
It causes conservatives in the states to not be conservatives, unfortunately.
I've heard the argument, we're just getting our money back. And when I hear that coming from Republicans, I just put my head in my hand saying, well, no, we're also getting some guy in Kansas's money, and we're getting some woman in Montana's money. And it's this bugaboo. Do you have faith in this, Dr. Blase, that the federal government can do that? It's great to say that we need a federal government reformation on this, but do you, having been there, hold out hope that something as big and as bureaucratic as the federal government can accomplish that?
I mean, I think in the next couple of years, probably not. I think the problems have to become more apparent, and there's got to be, with a lot of this, these wasteful government spending programs, it seems like there needs to be like some type of fiscal moment where policymakers are concerned about the debt and the rising deficits, and that a lot of these problems, the core structural problems with government programs, get addressed then. But it's very hard to change the status quo, and a lot of these hospitals are like the most powerful interest group in congressmen's districts. Yeah. And they don't want any of the Washington money turned off. So it's got to take a lot of leadership. And I think it's going to take a moment where, people get serious about the runaway deficits and debt again. Mm-hmm.
Well, I worry that, this system will get to a point where the Bernie Sanders, Elizabeth Warren faction of our, governing class will command the stage enough where people are seeing, Medicaid expansion doesn't work, Obamacare doesn't work. Maybe we just need to give up on the whole system and blame the system rather than the execution of a plan there. And that's always been my biggest fear, and it's one of the things that I keep, as you said, when the Republicans start, selling Medicaid expansion, I feel like they're almost signing their own warrant for the long walk down the Green Mile. But I appreciate.
So let me pitch you on one sort of broader health reform proposal. So the administration at the end of 2018 released a comprehensive report titled "Reforming America's Healthcare System Through Choice and Competition." I think you're right. The left sort of has this simple message: Medicare for all. Let's just simplify everything and have government in charge of everything.
Mm-hmm.
And we thought it really important to put out a different vision, because we know that there are major problems with the healthcare system. America's healthcare system is not free market. Government has a role all over the place, and most of the problems with America's healthcare system are because of well-intended, but the government regulations and rules that lead to a lot of perverse outcomes. So we argued in that report for a whole bunch of policies that would increase consumer choice, allow them greater control over their healthcare dollars, and that also would inject a whole bunch of competition onto the provider side of the healthcare market and allow all providers to practice to the full extent of their ability and skill set, because we think it's consumer choice and it's competition between providers, robust competition. That's the only way to lower healthcare costs without adversely affecting quality and access.
Brian, I really appreciate it. Dr. Blase, thank you again. It's blazestrategies.org. You have a wonderful weekend, and thank you for spending a little bit with us here at Freedom and Prosperity Radio.
Thanks, Joe. Appreciate it.
And thank you for tuning in for all of us here at the Virginia Institute for Public Policy. Find out more about us at tertiumquids.org. Until next weekend, I'm Joe Thomas. So long, and thanks for all the fish.